Healthcare advocates and supporters plan to rally on Capitol Hill today as state legislators prepare to vote on the bill that will expand the state's Medicaid program. If federal funding is approved, the bill will bring healthcare coverage to thousands of people in what's known as the coverage gap.
Results in other states have shown that any expenditure is offset by the economic benefits of bringing our tax dollars back here. But more importantly is the human factor. Thousands of vulnerable citizens who don't have access to health care because they can't afford it. These aren't lazy people looking for a handout. These are our fellow human beings who deserve our compassion. It's the fiscally and morally responsible thing to do.
Oops. You know, when I called a few months ago and scheduled the rotunda for today, they warned me that if we get too loud and get too disruptive, we could be asked to leave, which surprised me because 5 years of activism on this issue had convinced me that they can't actually hear our voices up here.
We fight! Healthcare is a human right! Stand!
And the doctor came in and said, I can't diagnose you without getting pathology, but I know that you have cancer.
The question I would ask really is, how much is a human life worth?
We stand! We fight! Healthcare is a human right!
I work hard to make this happen and feed my family. But when we ran into gap, it was very hard for us to survive.
We're not going to compromise. We need full Medicaid expansion without a delay because there are so many people like me and Christy and Paul and Leonard who need this health care today.
Come on, I have to be to work early today.
I thought you didn't go to work until 5 o'clock.
It's my other job. This is one of those days when I have to work both.
Why do you have 2 jobs?
So that you can have cold Pop-Tarts. Come on, come on.
You okay, Mom?
Yeah, I'm okay, honey.
Oh.
Hurry up in there. We need you on the floor.
That's where I am.
What?
I'm almost done, Ed.
Uh-huh.
You should see a doctor. Yeah, great idea. And hey, my kids ate last week, so.
I thought you were gonna try that insurance thing.
I did. I don't make enough money to qualify for help. I could understand if I made too much.
You do, actually. You make too little and too much at the same time. The way the system works is that you have to be over 100% of federal poverty level to qualify for premium assistance on the ACA marketplace. If you're below that, you're supposed to be on expanded Medicaid.
Okay. And I can't get on Medicaid because...
Because you live in this state. The Supreme Court decision in 2012 made it optional for states to take the federal funding to expand their Medicaid programs. Our state government hasn't chosen to expand.
To save money?
Well, not really. We're paying the taxes anyway. This would just bring the money back here.
Taxes that we pay, that I pay, go to the federal government, which they're supposed to be sent back to help pay for insurance for people like me. But the state government says, oh, no, thank you, federal government. We don't want the money back. Our people will just stay sick.
Essentially, yes.
I don't understand.
Neither do I.
Basically, I'm screwed.
Well, at least take a day off. Go home, get some rest. Maybe you'll feel better.
Yeah, and then I'll get fired. I'm already on written warning. I can't miss another day of work without a doctor's note.
So go see a doctor.
I can't afford to see a doctor. I can't even afford rent.
It's not going to go away on its own.
It's nothing.
Yeah, and it's been nothing for 3 months now.
Yeah, you think I don't know that? Look, there's this other guy, Rob, at my other job. He's way worse off than I am, and he's in a similar boat. You should worry about him.
I will.
So, is the new merchandise stocked yet?
Yeah, I'm almost done.
Can we hurry it up a bit? You've been a little slow recently.
Sorry, yeah, I'll do better.
I hope so.
You're not okay.
I know.
If something's really wrong, wouldn't they put you on some kind of disability?
Not unless I can get a diagnosis from a doctor saying that I am sick enough to qualify as disabled. And in order to do that, I have to be able to afford to see a doctor. And my car won't start, and I can barely afford rent this month.
Well, maybe you could...
Maybe I can what?
I don't know. This sucks.
When I was a kid, my dad used to tell me that if I just worked hard, did my best, that it would pay off. And my mom always said that if I prayed, that God would see me through. Well, I've been working and praying my butt off all my life. How come I'm sick and poor and everything sucks?
Maybe it's just that you're a terrible person. Oh, wait. And Ed would be sick, too. Shift's almost over. Can you at least go home and get some rest?
I gotta go pick up the kids. And then it's off to my other job.
Sorry.
I'm so sorry, I'm late. My kid's teacher wanted to talk to me about something. What's wrong? Where's Rob?
Angie, Rob passed away this morning.
What?
In his sleep.
He's just been sitting on the couch like a lump the whole time, and his forehead feels hot.
Poor guy. How much do I owe you?
Well, with last time included,
Right.
65.
Probably can't actually cash it until the 25th.
Hey, that's fine. You gotta do what you gotta do.
Thank you. See you next time.
After a contentious debate, legislators narrowly voted against the bill to accept federal funding to expand Medicaid.
Hey, I'm gonna take your temperature, okay?
Okay.
Here's House Speaker Daggett speaking after the vote.
We can't be in the position of being responsible for giving everything to everybody. It's not the job of the government to provide for people, and we can't be taxing people who contribute to society to give other people health care. It's a matter of personal responsibility.
Can we change the channel? I would love that.
Well, you have a fever. If this keeps up, we're gonna have to take you to a doctor.
Then can we take you to the doctor?
He's more important.
I think you're important.
Sweetie. I'm glad someone does.
With every passing day, the sky goes darker gray. I lose my faith and you keep your power. My desperation grows each hour.